Hello and welcome to Pain Unfiltered, where we go in-depth into the interventional pain and spine world with some of the top key opinion leaders and executives in the space. We are your hosts, Dr. Patrick Buchanan and Dr. Timothy Deere for this ASPN podcast. Let's get started. Welcome to the Pain Unfiltered podcast. I am your host, Dr. Patrick Buchanan, and with me is my co-host, Dr. Timothy Deere. Tim, how you doing as we inch closer to the ASPN conference?
Patrick, I'm doing really well. I was just down in Florida for the last week, and it just reminds me when I'm down there of how great the annual meeting is going to be in Miami, and it's just a fantastic place to be. And this time of year, we see the excitement build as we think about the program, and so really happy to have two of the instrumental people today who helped develop that program. I think it's most likely going to be the best ASPN meeting of all time.
I agree. We're super excited for this meeting, so much so that we're having a special edition of the Pain Unfiltered podcast mid-month. So we're going to be highlighting some of the contents of the meeting. And today we're joined by ASPN Executive Board members, Dr. Melissa Murphy, who's the liaison for the Young Innovators, and Dr. Kasra Amirdelfan, Vice President of Clinical Affairs. How are you guys doing today?
Doing great. Thanks for having us.
Absolutely. Thank you. I'm very excited to be here.
You guys have been obviously monumental in terms of getting this all organized from start to finish. Let's go ahead and start with the theme of this year, embracing disruption and driving innovation. How did you guys come up with this? And why don't you talk about kind of the meaning of this?
Well, thank you for having us. It's a very exciting time in our space, and as we're sort of emerging from being just interventional pain physicians into MIS surgeons, there's a lot of new innovation that's coming into our field in order for us to be able to help our patients better and better. And what better time for us to embrace all these new innovations, bring the evidence that we need for us to be able to treat our patients better with these types of therapies. This is the reason why we came up with this theme, because everything that we have at the ASPN annual meeting happens to be around innovation, but evidence-based innovation. It's not just about the new gadget that looks really cool and exciting. We need to know how it's really working for our patient population before we can actually implement it in our clinics.
I think, Kaz, what's really great about that is, we see disruption, which is one of the things. We come up with some new ideas. We work with engineers, we work with each other, we do studies. And then you see innovation that led to the disruption. But I love what you said. And I think one of the things that's great about the program that you and Melissa and others have built is they're taking the evidence from those things now and bringing that evidence forward, which is important for patient access, patient safety. So I love that. I love that you're incorporating all three of those things: innovation, disruption, and evidence together. I think that's why it's going to be such a great meeting.
I agree.
And I do have to comment on, Kaz and Dawood, you guys can come up with the coolest theme for every conference, and they're never the same. So I'm really impressed just working with you guys on this.
Thank you. And I have to compliment you on your program that you've put together. Tell us about Neurotech Horizons, because I'm really excited about that one.
Thank you. So this Thursday, this year, July 17th, we have something new. It's going to be in the morning from probably 8 to 12 o'clock-ish. We designed something for our industry members. So I know every time when our industry members come to ASPN, they've done so much for us, for physicians, for customers, for providers, and for our specialty. And this is the time we're going to do something for them. We want to create a community for all of our industry partners and members to talk about the development of an idea to innovation to device, to market development, to evidence generation, to identifying key players in the field and the sales and strategy side of things. So on Thursday, if you want to fly in a day early, and this is open to everyone, even if you're a physician, your provider, APPs, if you want to come in a little earlier and just join the industry members on this panel discussion, I think we have about 7 panels designed, anywhere from how do you create an idea? How do you get an FDA approval? How do you start a startup company? What about data, key players? How do you gain traction? What about M&A? How do you position your business for acquisition? And what about the sales side of things? How do you sell the medical device? How do you advance your career within the medical device sales? I'm really excited for all this. And we have representatives from different companies, industry members who join us and share their experience. I think more importantly, we're creating a community for our industry members so Aspen can be a home for everyone here. At the same time, we have labs going. So we have master's lab, we have fellows labs. So for physicians who want to learn more skills and learn MIS, learn neuromodulation, learn other more advanced procedures, we have labs going on at the same time. What I love about this is we have something for everyone, right? So this is not just a 2-day conference or 3-day conference. We're making it 4 or 5 days. So we can pick and choose what we want to do, how to best fit our own career goals and get the most out of our days in Aspen.
Yeah, it's true. So let's not forget about the practice management session that's going to be happening on Thursday afternoon. That particular program has been so popular that we ran out of space the last couple of years. So this time around, we've actually given it the major auditorium that we have at Fontainebleau, and we think that it's going to be the best attended one yet. And for Melissa's program and the practice management program, we not only have the masters of industry who are involved, but we also have private equity, we have banking, we have investors who are actually coming to the meeting to be able to collaborate with everyone. When Tim and Dawood came up with the idea of Aspen, I'll never forget, we were at Azra in New York. When they told me about it, we were standing at the bar having a drink, and they said, we're going to make this collaborative society called the American Society of Pain and Neuroscience. It's going to be fantastic. And I sat there kind of dumbfounded and looked at them, and I thought, why would we need another society? And I asked that question from Tim that very night. I was like, we need another society, like we need another hole in our head at this point. And he said, what I envision is collaboration. And he meant it. We started with collaboration of the colleagues, that we have that during the meeting itself. Now with Melissa's program, we're having collaboration of the masters of the industry along with the physicians so they can get to know each other better. That's incredibly important. But now investment banking, private equity, as we become more and more corporate in our practices, we need to learn about that sort of black box that's out there with a lot of money in it, so to speak. So we need to learn the pros and cons of it. And what better way to do it than a more collaborative atmosphere like this for us to be able to sit down and ask the right questions, get to know people, exchange phone numbers and email addresses, and keep in touch with each other for many years to come.
I love it.
I love that a lot of times we'll be on one of these podcasts, and we've got some great guests over the years, the last 3 years, but we'll be like, Patrick and I will be having to ask questions to get somebody to give some excitement. You two both are so excited. I think Patrick and I can sit there and look at you guys, and you guys can have the whole conversation. I do want to ask both a question, but I want to ask Patrick the same question, actually, and that is, one of the things we wanted to do was bring in ortho neuro radiology colleagues, and we've done that. So I'll start with you, Kaz, I'll come to Melissa, then Patrick. What's the value? And give me one reason to go. I want to make sure we have everybody has a time to give it an idea. But what's the value of bringing in more than just our pain colleagues here? What's the value of those other specialties to us?
The priceless value of having other specialties in the meeting is for us to learn about the way they think and the things that they look at in order to decide what they want to do for their patient population. So we're thinking outside of our box, outside of our training, when we start to get to know these specialists better.
And these are the things we don't learn in fellowship and trainings, right? And we have multiple panel discussions throughout the annual meeting that we have different specialties. We're all going to be together and discuss how we can work together, and things that I wish I've known in training, things that the surgeons wish them know about the pain side of things. So I think that's one thing that makes Aspen so valuable, is we can bring everyone together and have a collaborative approach to taking care of our patients.
No question. I'll tell you all an anecdotal story and why I think this is so important to have surgeons and radiologists. When I finished my fellowship, I started to, I didn't have a lot of patients on my schedules, and there was a very famous spine surgeon in the area. So I just went up to him and asked him if I could assist him on his cases so I can actually see what he does. And he said, sure, you can start scrubbing in. And the things that I learned from him through the trauma cases, the way he looks at the MRIs, the way he decides what surgery needs to be done, changed the entire foundation of my interventional practice altogether. And this is the reason why I think collaboration is incredibly important. So I owe so much to him because he taught me so much for the 3 months that I worked with him. But I feel like with repetition, with getting to know each other, the society is not only going to grow, but it's also going to become the best rounded society in MIS, not just interventional pain management, but also surgery and imaging as well.
Yeah, I think my answer to this, Tim, is the theme of this meeting, which is disruption and embracing, innovation. And there's so many things, even if you go back 5 years, let's just talk about sacroiliac joint fusion, right? It went from a couple of companies now like 60 companies, right? So, talking about these different minimally invasive procedures with our surgical colleagues, with our interventional radiologists, keeping up to date with the latest data with these late breaking abstracts that they're going to be presented, that's all going to be huge in terms of collaborating and figuring out the best treatment for our patients.
No,
Speaking of abstract,
yeah,
go
that's a
ahead,
lot of.
Tim.
So I was going to come to that next, Kaz. I think I got invited to go down to speak at the Ortho Spine Summit in Cabo, which is, I don't think they've ever had an interventional pain person before. So I think that reaching out to our colleagues like Pierce Nunley and Frank Phillips and Angel Boab, we have so many great surgical colleagues. We're reaching out to them is actually paying dividends because now they want to hear what we have to say. And I think that mutual discussion back and forth of respect that's going to make us better, especially for our patients. And I know a lot of the abstracts have involved some of the minimally invasive projects. And I know, Kaz, you've been working hard with your team of reviewers on abstracts. Where are we on that for the annual meeting?
I'm very excited to tell you all about the abstracts. But before that, you mentioned Pierce Nunley, and Pierce and I met through a research project, and I met Kevin Foley through another research project, some of the most famous surgeons we have in the country. And on a whim, I invited them to Aspen a couple of years ago. And since then, they look forward to coming back to the meeting. They actually clear their schedule to be there because they feel like it's a very effective meeting and it's the way they can learn about what it is that we do and collaborate with us, for all of us to become better doctors. But on to abstracts. So last year we had 208 abstracts, and we had gone from maybe 23 the first time to, low hundreds and so on and so on. But we had 208 last year. This year we had an unprecedented 324 abstracts submitted before the deadline. And on a daily basis, we still get calls from our colleagues who want to submit abstracts, but unfortunately, we're at capacity at this point, mainly because of the fact that we had non-conflicted abstract scorers score these abstracts for us. There were 3 scorers for each abstract, and the top scoring abstracts have made it to the podium. So we sat down with the committee just last night, and we picked 17 abstracts that will make it to the podium at the annual meeting. And we couldn't be any more excited because the majority of them are prospective randomized controlled trials done in our space. So this is the kind of data that we can all use to be able to treat our patients, and it's going to get presented at Aspen. These are all original abstracts. They've never been presented anywhere else. So it's a really proud moment for me and for all of us because I feel like the industry recognizes the importance of being able to interact with all the Aspen members, with all the attendees, to be able to get their message across. And this is the reason why we have such a large number of abstracts submitted from not only sponsored industries, but sponsored studies, but also physician-sponsored research projects as well.
That's great, Kaz. I have to give you and Dawood and David Lee a ton of credit for this. From where you guys started to up to now over 300 aspects. That's fantastic. And I had the pleasure of grading a lot of these abstracts as well. And we're getting not only our usual, partners, but also new physicians, young physicians that are submitting abstracts. Industry, young and old, a lot of the industries that haven't submitted stuff before are now getting involved in this. So it's quite impressive of kind of universally everyone chipping in and bringing together and pushing our space forward. So, I just want to congratulate you guys on doing a fantastic job at pushing this forward. I see social media all the time about getting the abstracts in and stuff. So you guys have done a great job with that.
Thank you so much.
Uh,
Thank you. And I'm excited to let you all know that there are people from all over the world submitting abstracts. We've had abstracts from India, Iraq, the Netherlands, France, Australia submitted to the ASPN annual meeting. So
Yeah,
this is no longer a domestic meeting.
I just wrote a few letters to some countries to get some folks to be able to come to the meeting because it was a little difficult to get a visa. So yeah, there is some excitement there around the world, and I think that'll build into this meeting and then into London. So Melissa, you mentioned earlier when Patrick introduced you, you said you were the liaison to young innovators, which you were one of those, and you're still pretty young, but now you're stepping up, and people may not know you're going to step up to the executive level as treasurer here in July, and we're excited about that. I think you'll be a great addition there. So as Drake once said, we started from the bottom. Now we're here with these young innovators. Where are we going? I mean, you're gonna have that weird role of coming from young innovators to liaison to executive board. Where on the executive board level are you going to help lead the young innovators at this annual meeting? What do you think is in it for them if you're a fellow or in the first few years after fellowship right now? Why would you come to this meeting?
Yeah, thank you. So if you are one of those who are going to fly in on Thursday, we're going to kick off the meeting with a Young Innovators reception on Thursday evening. So make sure after you land, you come to our reception. This is the time you're going to meet all the young innovators of Aspen. And I have to say that, Aspen is the home for young innovators. We have hundreds of members who are in the early career stage, resident fellows, and within 5 years of training. So we're going to have an award ceremony for the new Young Innovators Award recipient. We're going to discuss where we're going as Aspen Young Innovators. We're going to celebrate us, the young physicians in this space who are innovating, who are doing research, who are truly pushing our field to the next level. The Young Innovators Committee has been working really hard this past year. We have webinars. You see emails from us all the time. We are collecting resources on how to do certain procedures, mentorship. We're trying to do something in a job board. I know many of you guys have seen that as well. We're trying to be a place of a resource for all the young innovators, a one-stop shop for you to learn procedures, find mentors, even find jobs, and we're going to help you grow your career as well. And then following the Young Innovators reception, we have our postered podium reception, which is always a highlight of Aspen. This year, we have about 9 to 10 exceptional participants who are going to present their research project that they've been working on for the entire year. And this program is open to everyone, industry members, physicians, postered podium alumni, participants, and we're going to celebrate these 9 or 10 physicians who work so hard in the entire year to work on their presentation skill, their research skill, and then the research that they have developed over the year. And then we're going to kick off with our application process with a new year of poster to podium. So for those of you who are interested in part of the program, this is a time to meet the leadership, to learn from previous participants, learn about this program, and see how you can get involved and participate for the next year. So that is a Thursday. I think we have a really busy Thursday planned for everyone.
It's a busy weekend.
Yeah, Melissa, you've done a fantastic job with the putting presentations. A lot of the people that you've mentored are now faculty on Aspen and are leading workshops, or leading webinars, or consulting for a lot of the companies. So hats off to you. And
that's Dr. Erica Peterson's vision. I have to give her all these credit. And 6 years ago, she created this program, and she has truly impacted many of our lives. She developed many of us from being, early career physician to where we are today. So I think she is truly the reason Poster Podium has been very successful.
No question.
100%. Erica's done a great job with that program. That was her original idea, early on when we started the society, and to see it build has been fantastic. We're going to build into an MIS certification, which we're going to announce at this meeting. And I think those two things will complement each other pretty well. Some of those people will become the instructors and the mentors for that program as well. And so I just want to, I know this has been a great discussion so far. I just want to change course a little bit here. And I want to go to Saturday, so we talked a little bit about Thursday. Friday and Saturday is the main agenda, Kaz. And
yes.
You want to just give us a few highlights of that?
You bet. So, as you all know, Aspen's annual meeting has always been architected to be a panel discussion. The reason we have panel discussions is because we want to hear from as many experts as we can in the same venue, while yet some time to be able to collaborate and question what it is that they're doing in their practices and in their research projects. So. Uh, it goes without saying that there are expected topics that we have for panel discussions, like neuromodulation, radio frequency ablation in various zones in the body, and so on. But there's three very exciting categories that are emerging, and we've added those categories to the panel discussions for Saturday. One is orthobiologics and pharmaceuticals. So orthobiologics have evolved over the past decade or so, and they're getting to the point that they're going to become the standard of care in the United States based on a lot of prospective randomized controlled trials that have been done in the past 2 decades in the United States. So and also around the world. So it's time for the Aspen members to learn about the evidence of orthobiologics and decide how they're going to select the right patients for them to use them. Uh, Pharmacological therapies sort of took a backseat for a very long time, mainly because of the fact that we were all trying to get away from opioids. But there is a renaissance of new pharmacological therapies that can potentially help our chronic pain patients quite a bit. And we are starting to hear about these a lot more. And we have some pharmaceutical experts who are going to be on panels to discuss about some of these emerging therapies. Last but not least is endoscopic procedures. So at one point, we only had surgeons, then we had interventional pain doctors. They didn't really mix. But now, with the endoscopic procedures and with the advent of minimally invasive spine surgery, the two are becoming one. And endoscopic procedures are becoming more and more prevalent in interventional pain. So we have a lot of experts, surgeons and interventional pain physicians alike, who will be talking about how they're selecting their patients and how they keep their patients safe and the procedures effective using endoscopic procedures in their practices. Those are the three topics that I'm super excited about, and those are the panels that I'm not going to miss.
Great.
That's fantastic. Yeah, that's kind of like the heart, the meat and potatoes of the conference, where we're talking about evidence-based medicine. And like you said, Kaz, we're bringing up the top leaders of our fields talking about these in different panels. So that's fantastic.
That's right.
Melissa, we'll turn it over to you. You want to talk about the breakout sessions. And truly, this meeting, like you guys said, is for everyone, APPs, young innovators, well-established practitioners, surgeons. Why don't you talk about the breakout sessions?
Yes. So on Friday, outside of the main meeting, there's going to be a breakout session for the APPs. So we want to create a community for all the advanced practitioners to come together to collaborate, to discuss difficult patients, difficult cases. How do you do things and exchange ideas? So we're going to discuss neuromodulation. We're going to discuss MNS. We're going to discuss medication management. There's even a topic for pelvic pain. So that's going to go on for a few hours on Friday, in addition to the main session for all of our APP participants to learn from each other and to network with each other. And on Saturday, there's a separate breakout session for business and law in medicine breakout. So that's the time that we're going to discuss things that's outside of medicine, evidence-based or procedure or techniques. We're going to discuss the business side of things, the compliance, the law side of things. So I'm really excited about this as well. Truly, this is the conference for everyone. I think we're all going to get a lot out of it based on your interests and the special topics you're passionate about.
I want to add two things to that. So I love all the breakouts you're discussing. Two things I want to remind people of as well. So the 5K for charity is going to be on Friday after the session. It's going to be not that hot there in July. 5K isn't that long. So you can walk, you can run, or you can just have a drink at the bar and donate money. We'll be raising money for the Ironman Foundation there. And then there's going to be a Saturday evening reception sponsored by Aurora, which is our annual. It's been called different things over the years, but it's a reception and it's a speakeasy type of venue. And we recommend a $50 donation for that to join that reception. And that's going to go to Return to Duty. David Reese, our director of our chairman of our military division of Aspen, David's really been a great fundraiser for that great charitable organization. So all the funds for that reception will go to that charity. So I think we're going to have two charitable events that will be very, very important. I want to really encourage everyone to come down and really participate in both those, one for fun and one for recovering from the fun from the day before. Should be quite good, I hope.
That's great. And Tim, can you comment on the award ceremony that we're going to have on Friday night?
Yeah, so the Aspen Awards every year. The executive committee takes nominations, and we've been announcing those over the last few weeks on social media. So we like to honor our colleagues, and if you want to kind of see a list of those, we'll repost those on our website. But we like to honor scientists who've done a great job. We like to honor those in clinical practice. We like to honor those for lifetime achievement who really contribute to the field. Like to honor those who've done things for the younger innovators. We like to honor those who've really increased diversity. So we have all these awards there, but I think it'll be very valuable. So we'll be doing that on Friday evening outside of the reception. But I think we're also going to honor the APPs during the APP session. I think we're going to honor the young innovators during the young innovator reception. So we're going to have a chance for people to really celebrate with their colleagues, and we'll be showing those awards as we go along the meeting. So I think that's very important. We started that in the very beginning, and it's been a tradition. And I think really we need to celebrate those who do great work and hard work. And so we're going to continue to do that. At some point, we'll give Dr. Amirdelfan the Lifetime Achievement Award. He's too young right now. I think it's a little older, a little bit more.
No.
We'll give you that award, but not yet.
Yeah.
Not yet. We're too young.
I feel like they're gonna hand me the award and push me overboard. It's
Come
like,
in.
that's it. Bye.
When it comes, though, Melissa, you be prepared, because when it comes, it's going to be
Exactly.
Thanks for mentioning that, Melissa. I don't want to get into the detail of each of the award recipients. We posted those, but I think it is a great group of people. And, it's just such a great, wonderful thing for Aspen to have so many people to choose from. So many nominations come through each year. And it's just so difficult to choose for the committee. So I think that goes to show you the quality of people in our organization. And I'm just honored to be here working with all you folks.
That's great.
And
So go ahead.
go ahead, Melissa. No, I was just going to say I would be remiss if I didn't mention how we've squeezed so much into a 4-day meeting. And, if I had my wish list, the meeting would actually be a whole week, and people would have some free time in between to be able to basically recoup and discuss. But this is the best way that we found to be able to add everything that is important to all of our membership into one very effective weekend. But it doesn't stop there, so we start working on the next Aspen's program literally 2 weeks after the program is done. So it's a year-long labor of love. We start to put the topics together. So we need communication from every single Aspen member, from every person who comes to the meeting. It's really important for you to give us feedback about the meeting. Tell us the kind of topics that you'd like to hear for us to be able to design and architect the next meeting. The other thing I was going to mention is that Sunday is not the day that you go home. If you're going to go home on Sunday, you leave in the afternoon, or stay and get a massage and just leave on Monday. Because we not only have the P2P programs, top abstracts that are going to get presented on Sunday, we've been able to squeeze in several different very important keynote speeches, as well as a few of the top abstracts that didn't make it on Friday and Saturday to the Sunday morning session. It's incredibly important for everyone to recognize that session is probably the more relaxing one, and probably the one that you're going to learn from the most, mainly because of the kind of data that you're going to see from the abstracts and from the keynote lectures.
So to wrap it up, great discussion. Can you both give us one really key reason? I know you said so many things in this session, but give us a key reason to come to Miami July 17th and 20th and join us. And the website's www.aspenpain.com. You can go there and register. And if you can't find a hotel, we can help you with that. But give us a key reason. I'll have both of you give us that reason, and we'll let Patrick close out the podcast.
Ladies first.
Thank you. It's about the experience. I mean, if you think about the past few Aspen meetings, I honestly don't remember all the panel discussions we had, but I remember the people. I remember how I felt. I remember the experience. I remember how each Aspen meeting is propelling me forward professionally in my career. right? So at the end of the day, it's about the experience, it's the people around you, it's the friendship, it's the path, the journey as interventional pain physician along the journey. So I wouldn't miss any ASPN meeting. I think this is our, the favorite time of our year is July in Miami to hang out with our favorite people, learn about medicine and pain medicine, and take all that home to take it for patients the next week.
Great. Kaz?
Here's the agenda. It's actually 32 pages long. 32 pages long. I kid you not. And why is it like that? That's because